Welcome everyone to this presentation on big data analytics and dynamic simulation modeling for Tri-County Healthcare. It's great to have you here today, and I look forward to discussing this important topic as we look at ways that we may improve Tri-County Healthcare moving into the future. To start, I'd like to say a little bit about myself. My name is Jonathan Cordell, and I've been working in organizational improvement and development for over 20 years, analyzing and improving companies in many different areas, including healthcare, pharmaceutical, military, financial services, and education, which was actually where I began over 20 years ago. Along the way, I completed a doctoral degree in organizational psychology at Rutgers University. As we begin to consider what it is that Tri-County healthcare is facing, it's important to think about the larger healthcare industry. There are a number of challenges that are coming our way. These include keeping up with technological advances, which is the core of what we're talking about today. Then there's harnessing that technology to best serve and help our patients, as well as using that technology to serve the community more broadly and make sure that we're meeting all of the needs that are out there within the community. Then we all face pressures. We hear about it in presidential debates. We hear about it everywhere we turn, it seems, the way that healthcare is struggling, whether that's with rising costs or with the tightening payment structures or the skepticism that is building with patients towards our providers and our system. These all challenge us, and if we can identify ways, especially using those technologies that we discussed, to address those pressures in the industry, it will be to our benefit. I've been discussing with leadership at Tri-County ways that we may use the technologies that are now available to improve the system as a whole. This is a decision brief for looking at what I'm recommending, which are two software packages, one being big data analytics and the other being dynamic simulation modeling. They are softwares that offer ability for managing care and identifying opportunities for ways that the hospital can improve both for patients and as a business. The way that the big data analytics and DSM help the hospital and ultimately our patients is to transform data into action. We can run analyses that are not currently possible, that will find patterns, trends, habits in a different fashion from what we can currently do with our system that we have, as well as then base decisions on what we find in those analyses. So this is what I would like to look at, and by the end I will identify several vendors who the hospital might consider. However, really this brief is intended as a decision brief to ensure that this is the route that the leadership of the hospital would like to put effort behind to make sure it's the way they would like to go. So what are some of the outcomes that Tri-County Healthcare might be able to expect if it implements big data analytics and DSM softwares? Some of those outcomes might be improved patient care, such as less waiting time to get an appointment, or less time waiting from appointment to procedure. For someone who needs surgery or something serious, this could be a great impact. Also, likelihood of making fewer mistakes as the software can guide decisions along the way. For the hospital, on the business side, both cost reductions and increased revenue are likely to occur with decisions made based on the softwares that are being recommended, more precise staffing for cost reduction. Are full moons real? So is it possible that we do need to staff up during full moon times in order to meet patient demands? Something we talk about, but we don't have absolute answers on. Also, that supply chain, just-in-time ordering becomes even more possible, and then utilization of our spaces and services. So we would be able to identify, are we underutilizing operating rooms, or could we potentially provide more MRIs that would both serve our patients and the hospital through, again, that reduction in time to the MRI, through the efficiencies, as well as then the revenues generated by providing additional MRIs. These are likely results of implementing these softwares. In considering new and emerging technologies, we need to understand where Tri-County is coming from and what brings us to this fork in the road at this time in the history of the hospital. So we are a not-for-profit healthcare system serving rural, suburban, urban communities, so geographically distributed. In our three hospitals that make up the system, there are about 1,000 beds, as well as then we have 8 outpatient facilities. With close to 8,000 employees, we make up a large part of this community, definitely a center for the community. The health care that we can provide is varied, but as anyone who hears Tri-County knows, we are considered the leader in childbirth-related services, so maternity and neonatal care, and those are the areas that we lead. For Tri-County, when we look at that area that we serve, what we can see is that locally we do have the strongest position in Center County, which is the most suburban. It certainly has some urban areas, but it is primarily suburban. And then I already mentioned our best-in-class position in childbirth-related services. Then additional areas where we are known and do serve the community well are orthopedic care with rehabilitation, as well as our pediatric services. However, what we have begun to face is that we have older facilities that need to be updated to continue serving the community, as well as have not being recognized as much in other areas such as cardiology or neurology or gastroenterology, areas where we have quality doctors and may not be serving the community as well as we could. As we consider what emerging technologies have to offer for Tri-County, what are some of the opportunities that exist for Tri-County as a healthcare system? Some of the current opportunities are Center County is growing. This is a great place to live. It's a great place to work. It's great for families. So there's a real draw for people to want to come to Center County, and we want to make Tri-County Healthcare be an employer of choice. Some of the ways to do this are growing that third medical specialty leadership area based on the community need, to improve our utilization for specialties that are underutilized, and of course our view by the community population will improve as we improve our hospital facilities. That will become possible if we can improve our revenues and grow our healthcare system at large. What are some of the threats to Tri-County healthcare currently that might hold us back? Well, we all know there are two neighboring healthcare systems that are university-based, have great prestige, and are similar size to us. They have name recognition that Tri-County does not have, and they are also looking to grow. So what is it that Tri-County can do as currently the third choice in health in our local vicinity? How do we use cutting-edge technology to begin to improve our positioning and expand our foothold? That is what we're going to continue to look at in this presentation as we consider what big data analytics and dynamic simulation modeling have to offer for Tri-County healthcare. To meet the challenges of having these rivals right on our doorstep, I know the Tri-County Health Executive Team has been meeting and looking at ways to implement cutting edge approaches. So it's great to have the Chief Information Officer here for making the decision of do we move forward with this or not, as well as the Chief Medical Officer, because ultimately it is those medical staff and programs that carry out the impacts of the potential solutions that we are discussing. And obviously, your IT staff is going to be directly involved in implementing and maintaining the software that's being recommended if we go that direction. But having the nurses and doctors on board and willing to take part in the changes is very important, because ultimately the success or lack of success for implementing the softwares will depend upon the nursing and the doctors on staff. Big data analytics are one of the key software recommendations for meeting the challenges of those rivals and helping Tri-County to become more cutting edge as a healthcare provider. What is it that analytics offer? The biggest advantage that big data analytics offer is that they're able to look at larger sets of data and configure and evaluate that data in different ways. Uh, the data can integrate observational data, so doctors or nurses' observations of patients and comments that they can put in a record can actually become part of the analysis. Um, Data is collected in real time, so movements, swipes, anyone coming in and out of the facility can ultimately be tracked, and anything that's going on as well can be tracked and then fed into real-time modeling of exactly how services are being rendered and what services are being utilized. That way we can start to begin to predict and model how it is that the system is actually functioning, rather than looking retrospectively through files and records, which is what we've been doing to date. We have an electronic health record system on deck that currently serves us well. It does great at keeping records. It does great at meeting legal requirements. However, if we want to push to that next level and become cutting edge, having a big data analytics software package on board would really help us out. The second software being recommended to help Tri-County be cutting edge and forward leaning is DSM, which is dynamic simulation modeling. This allows models of the flow through the system. So we can look at the functional aspects, what is interdependent on what else, in the sense of, is there something at the desk, or is there something with the nurses in terms of provision of services, or is it the doctors, or is it that the operating room is not being cleared out because of cleaning staff that's causing delays? What are those interdependencies and flows that cause either clogs or gaps in our system that we could address and become more efficient to better serve our patients and ultimately improve our business results? Another aspect of DSM is that we have the capability to test out our theories, so we can have multiple hypotheses, configure the data going into the model different ways, and generate results based on those. That way we have more likelihood of being on target with our final decision, because we were able to operationalize and test multiple theories for what we could expect to be the actual outcomes. Currently, Tri-County owns an electronic health record system that does what it needs to do and certainly meets the legal requirements. And that's the main aspect related to technology for the healthcare system. As we noted before, dominant in maternity-related care, leader in orthopedic rehabilitation, uh, has up-to-date medical devices, so we're not struggling there. We have an open MRI, and we can support a variety of specialties that are offered by the system. Uh, on the other hand, our facilities lag behind, and we do not have the same reputation as our rivals in the area, who we would like to get on a cutting edge to stay ahead of. If Tri-County chooses to implement big data and DSM, what are the possibilities that exist for the business? The main possibilities are becoming a local leader, focusing on an in-demand specialty that they identify using the data from the big data as well as from the DSM. In particular, they can use the community care analytics from the analytics software that they purchase. They will have visibility on their patients' behavior. So why are they choosing Tri-County? What do they like? What do they avoid? And how can Tri-County use those preferences to benefit both their service and the patients? They can increase their occupancy and utilization rates, so increase the utilization of those satellite facilities, as well as identifying patterns and trends for their occupancy of their hospitals to best serve those. They will then have the opportunity, with the additional revenue and cost savings, to update their facilities, which is badly needed to improve their market position. As they do all of these things with new facilities, with better patient care, with better service to the community, they're going to see that reputation grow, and those combinations are going to lead to them being able to fend off those ambitious rivals from the two local universities. Some of the benefits of implementing big data and DSM for Tri-County include real-time identification of what is going on in the healthcare system. So in particular, which patients are choosing TRICARE, and you'll know immediately through swipes, through data input. Doctor records are uploaded immediately and integrated with all of the other data that has come through. Any aspect of care, as long as there's a process of whether it's written or some form of RFID or swipe that is transmitting that information, whether it be utilization of an operation room or who has come into your waiting room in your satellite facility, all of that information is then sent into that analytics software for analysis and integration with current and future predictions. There you can identify, using in particular that DSM, any clog points or lapses in flow. So what space is being utilized? What equipment is being utilized? When is it utilized? Who is utilizing it? As in both what type of patient and issue for the patient, and what type of doctor is using that bed or that room or that piece of equipment. All of that information can be put into those flow diagrams and models for space utilization and efficiencies. Finally, fluctuations in demand are going to be identified through that analytics software. So those common questions: are full moons real? Do storms bring on labor? So do we need to upstaff our maternity and childbirth staff during storms? And how do we do that? All of those things can be identified that DSM then will take on and add to that analytics software that we have in place to optimize. How do we plan for storms? How far out? How do we work this? And that DSM can actually model and make those assessments for how to best use those analytics and bring the combination of the software together. Continuing with those benefits of big data and DSM, I've talked about it several times to now, but that identification of an underserved medical specialty, that analytics package, and the community care offering for analyzing the community will help to identify where the community is underserved, that Tri-County can jump in and become a leader in that space. Maybe it's oncology, maybe there are underserved local cancer needs that right now are going to those university rivals, where we know that they are positioned as national leaders in oncology. If Tri-County can serve that local space and become a local leader for our community's needs specifically related to that, then we can start to build a niche there. Selecting a third specialty for that leadership is so important to us because it will enable us to build that reputation and really serve our local population. Additionally, by having those analytics in place, that will reduce that guesswork or building on a single doctor's reputation that has occurred previously. And then lastly, the DSM helps us to model and simulate exactly what the impacts of that new specialty will be. What are the staffing needs? What specialized places do we not currently have? If it is oncology, will we need to build a chemo room or adapt the space of one of our current spaces into a chemo room where we can have outpatient chemo services? Any of those types of items can be identified through that movement and that utilization of space that is possible with a DSM software. So we've looked at some of the benefits that would come to Tri-County through the use of big data and DSM. What would be some of the outcomes? We've touched on some of those previously, but in particular, Tri-County would be looking at increasing revenue as that space and equipment utilization is optimized through applications of the information that is gathered through the DSM software, especially utilization of ORs, where we know large amounts of revenue can be generated. Flexible staffing and flexing the space to meet those fluctuations identified previously. What about during full moons? What about during storms for our maternity ward? How do we manage that? As well as then that leadership in a third specialty area for our community. So as we grow that certainly will be increasing revenue through that leadership position and patients choosing to attend Tri-County facilities. Increased patient satisfaction will be another result thanks to the implementation of these softwares. So when wait times are reduced, procedures are more available, doctors are experienced as being more available, and patients prefer that. Also, those analytics will improve the precision of care that our health system and doctors are offering. The analytics that we find through that big data will feed into individual patient decisions, which will, of course, increase the precision that we're delivering, reduce mistakes, and reduce uncertainties in serving those patients. The last aspect to look at there is knowing our patients' preferences. Why are they choosing us? What is it in particular that they like about the maternity services that we have to offer? As we learn those better and are able to really focus and emphasize those even for ourselves in our work, patients, again, will continue to attend those Tri-County health services and increase that satisfaction because, again, we're listening or recognizing what our patients prefer through the data that we have gathered, and then we are following through on what it is that they like about what we're able to provide. And here are the big outcomes for Tri-County. So as those revenues have grown, as we have satisfied patients who recognize what Tri-County is delivering to them and how Tri-County is focused on those patients, the revenues will enable us to invest for the future. That increased bottom line will let us update our facilities, whether that's breaking new ground, whether it's revamping what we already have, whether it's changing up those spaces so that we are, as noted earlier, focusing on having a chemo suite where we can really deliver a leadership in oncology if that's what those community care analytics indicate. We can do that. We can invest in that. Those satisfied patients, those improvements all lead to an improved reputation. Tri-County might even move from being third locally to being more recognized. That probably won't happen nationally, but on that local basis, we can become the healthcare provider of choice through these implementations of analytics and DSM, and really focusing on those throughput factors that will make a difference to our patients and our bottom line. That availability of services, of course, is going to make a huge difference to our patients because now they can get in, they can get the service they require, it can be exactly what they need. It won't be an overshot, it won't be an undershot. It will be a precise delivery of the medical treatment that is most appropriate for that patient, and we will have that detailed through that analytical analysis. And of course, that other piece is importantly that we will defend our current market position, if not expand it. So we would make it much more difficult for our competitors to expand into Center County, and potentially even our satellite offices would grow and expand into their current territories. Now that we've looked at the potential outcomes and the future state for Tri-County that could be enabled through implementing big data analytics and DSM software, how would the healthcare system get there from here? The first phase of implementation would involve determining what issue does Tri-County want to address first. Is it going to be the throughput and internal efficiencies, so operating rooms, flow through our various satellite facilities, through our hospitals, or is it going to be external community health needs? Is it going to be that community care analytics that we can run through the analytics software to determine that market need and target that first? Once we've decided on that, then there's a need to determine and work through the methodology. So this is going to involve IT and doctors and staff getting together. They're going to have to look at what theory they want to implement, what data then would they collect based on that theory. What's great about the software packages being considered is you can take advantage of multiple theories and you can test them against each other, selecting the variables of that data that's going to go into that, and then pushing out results. Pushing out those results, testing those alternatives, and looking at what does that mean for Tri-County? How does this impact our actual operations and outcomes? Can we validate that data? So run multiple tests with varied data, or changing up exactly what variables are included under that assumption. Do we get similar results? Once we've tested that and what wargamed it frequently enough, then we can make that decision when we're comfortable. So once that initial decision has been made, then the next and potentially most important phase is going to be that rollout, right? This is going to involve change management, and that's where having had those doctors and nurses involved in that testing and theoretical step is going to be so vital, because now you have their information, you have their interests included, and now we can start to roll this out into those spaces where it's going to make a difference for the healthcare system. So maybe that's increasing operating room utilization. So as we roll that out, who's going to be impacted? Who from those groups was included in that discussion and those theories and those developments? Roll that out to them, and then bring that into place. Train those staff that are going to be involved in those most impacted specializations. Maybe that's orthopedic surgery, given that that's one of our leadership positions. Do they need to be trained on new procedures for the OR that will help them to be more efficient relative to what we identified using that DSM software? Then, for that staff, making sure that they understand that the efficiencies are not just about how they are moving or where they are positioned or what the operating room exact scenario is, but it's ultimately about benefiting that patient. It's that by better utilizing our operating rooms, there's going to be more access to care. So by more efficiently being able to provide each procedure and managing and utilizing the operating room with greater consistency means that more patients yearly receive surgeries and procedures that improve their lives. So while it can sound like, yes, this is about looking at flow in an operating room and how much time is there and how we are cleaning it and moving forward with the operating room, it is ultimately about being able to provide the necessary medical care to more patients more consistently than currently happens. And as we are providing that as a healthcare system, we are improving the quality of more lives than we currently are, because they're able to get their necessary surgery more quickly. So once rollout has occurred and now the change management is being implemented in the military, there's a saying that the adversary has a vote. And that means in a hospital setting that the reality of implementation is not theoretical. So that adversary of what really happens is going to have a vote, and it's going to impact what really happens. The tremendous offering of big data analytics, and even potentially reutilizing that DSM software, reassessing with that, is you can monitor in real time and you can continuously improve. So if there were any assumptions that were incorrect, or if patient needs and wants change as we're implementing, we're going to know that because the data is captured immediately. That's what real time means. It's captured as we go and fed back into the analyses that are going to be kicked out for us to consider. Whether it's through RFID swipes, whether it's through monitoring of drug utilization, whether it's through doctor's notes, we are capturing all of the movements, all of the information that is going into and occurring, whether it's a nurse's note on what went wrong or what went well in that particular operating procedure, what was not identified for the nurse's movements and what's necessary for the nurse during a particular procedure. We can capture that and make sure that it's incorporated for future integration of that change that we're implementing. Those quick adjustments and improvements are going to benefit both our staff and our patients. Then finally, As we go forward, there are going to be next projects. We've already identified the intent for the future of Tri-County to grow that reputation and to build that market and to ultimately have the opportunity to break new ground or improve facilities. We're going to need to look at next projects beyond that first one, follow those same steps that have already been taken, applying those software packages that allow that sophistication for our understanding, and we will continue to build and grow in those ways that Tri-County has identified as desirable. So we can create that great future state of improving that reputation and growing those markets for Tri-County by implementing and following that phase-wide procedure with the big data analytics and DSM software. But what are the risks that would be faced? The primary risk would be what any organization faces, and that is making a big purchase and doing nothing with it, having so many internal resistances that actually nothing happens and it becomes an expense rather than a growth opportunity for the business. One of the main ways for Tri-County to manage that with these software packages is to include those who will be impacted in the decision-making process. If purchasing software in this instance is only an IT activity, then the chances that the doctors and nurses actually accept what it is that's being produced by the software is going to be limited. They're going to have a response of, what does a software know about my day-to-day? How can a software tell me how to do my job, or what's going to make me better or make my patients more satisfied? They're going to have a response to the software that says the software is just technology. It does not understand my job and my patients the way that I do. So it becomes vital in this instance for Tri-County to include those doctors and nurses in the development of any theories, in the consideration of the software to be actually purchased and implemented, so that now they will be motivated to determine how the software can actually help them rather than cause them problems, but actually offer them better patient care, better actual professional service capability through seeing what the software is identifying that can actually make the system better for their patients. As they see those improvements for their patients and realize that the software is not telling them they are doing their jobs incorrectly, they will be motivated and they'll follow through. And that's going to make it more likely that the software has the impacts that we are looking to bring into Tri-County. Another risk to Tri-County regarding implementing big data analytics and DSM would be mismatching decisions. That would be if predictions for some reason were incorrect. Maybe that community health need was not as clear as we thought. Maybe it was just a blip for a single year. Now we've put all these money into moving in this direction, and it's not actually a need that the community had. In that case, that profitability that we'd be targeting would not be growing. What is valuable with the software that we are looking at and recommending here is that big data is quick. It's real time, meaning that immediate feedback we would quickly identify within probably a quarter, max two, that decision was not actually on track with what the community demand for that service actually was. We would then be able to adapt and shift from that strategy that was being implemented. We would use that software to look at and identify, well, what did we miss? What are the actual patient needs and community needs and realities so that we can now shift over and address those. That information is being looped into that software. It's being used for organizational learning and decision making on an ongoing basis. And that would certainly be part of the implementation, is going to be having assigned personnel to look at those results, whether those be IT, whether those be other medically related staff, or some combination of the two, to continually be considering that data and information and what it is telling us about the system, whether that's the needs of the patients, the doctors, the nurses, or other staff, for those decisions to have their intended impacts. The last risk for Tri-County related to implementing a technology is doing absolutely nothing, sticking with the status quo because it saves costs up front. Any of those approaches that lead to not implementing a new approach are going to cause Tri-County to stagnate. That approach is ultimately going to allow the two local rivals to expand into Center County. They can use their prestige and their reputation to push into the current areas where Tri-County does have the strongest foothold and start to take away market share. They may take over those new opportunities, such as the community care opportunities that have been discussed throughout this presentation, by adding specializations themselves, which would ultimately cost Tri-County the opportunity of moving into those markets. It would freeze out Tri-County. The way that Tri-County can address this is primarily to choose a cost and resource effective new technology. What technology on a cost benefit analysis will allow Tri-County to build its reputation, to grow locally, to hold that foothold in Center County, to emphasize those maternity services and orthopedic services, as well as grow into that new community care market or improve those throughput factors that improve those revenues for the business. In this case, one can say the best defense is a good offense. So bringing in those analytics and DSM technologies will lead to those improvements in efficiencies, in effect, as well as growth opportunities for development. Completing that cost-benefit analysis and selecting the most appropriate software is going to be to the great benefit and building the future for Tri-County. So now that we've considered the risks, especially the risk of doing nothing, what are actions, right? Actions being the opposite of doing nothing. What are actions that Tri-County might take in order to implement big data analytics and DSM? So we can consider a number of vendors, and I'll put two forward here for consideration and what I can explain about those vendors. So the first would be Cerner software, and Cerner offers a more a la carte type of approach to analytics software. So for example, with Cerner, Tri-County might purchase their Health E-Analytics for the big data analytics and doing the bulk of that predictive analytics work that can support the healthcare system, as well as Health E-Care, which could be used for looking at the community healthcare needs and identifying those services that might not be provided well locally. Looking at Health E-Life, which can look at those patient engagement factors. So those patient preferences that have been discussed throughout this presentation All of those facets can be chosen on an individual basis using that Cerner software. Another consideration, and this is where a cost-benefit analysis would need to be done to really make good determinations and decisions for Tri-County as a healthcare system, but potentially even a longitudinal care package that Cerner offers might improve our precision of individualized diagnoses and decision making for patient care. Again, that's one where the decisions really need additional information for Tri-County to look at. Epic is another software vendor who could be considered. They offer large packages. They are dominant in the field of healthcare analytics. However, their packages are large scale packages. They are somewhat monolithic. Once you're in that Epic ecosystem, it's mostly all Epic. And so with that approach, the reason that I'm putting Cerner as the first option is Cerner is we can pick smaller pieces and integrate that with what we already have. An important note is that both Cerner or Epic offer either local or public cloud, and so that gives Tri-County options for how we would want to approach the housing of the data and implementation of the software. Related to any course of action, of course, is going to be what is the cost to Tri-County? As far as Cerner and Epic and related analytics softwares go, uh, they follow a similar cost structure application, and that would be a one-time license fee, and that's based on volume. So Tri-County being relatively small to mid-size, serving several counties and having approximately 8,000 employees. So our patient throughput, our doctor and nurse utilization, that's going to be relatively small in the bigger software spectrum. But there will be a one-time license fee based on the volume that Tri-County will have with that software provider, as well as an annual maintenance fee, again based on the volume of utilization. As far as the initial launch for the software package, the installation, those events that are associated with the launch, and any of those initial trainings, those will be included in the initial quote from the software provider. I have reached out to both Cerner and Epic and have not heard back from either one of the companies. Uh, Obviously, once there's an absolute decision made and now they are actually in competition, they will be more likely to respond and help Tri-County to work through that process of that cost-benefit analysis for determining whether the a la carte version that I'm recommending is the primary choice available through Cerner, or a more comprehensive system, such as that offered by Epic, is going to be in the most cost-efficient space for Tri-County to choose. Turning now to the dynamic simulation modeling software, the market leader in the space is SimCAD Pro Health. They have healthcare industry specific data, and that really is the focus of SimCAD Pro, is they focus on industry and really looking at that business and the flow through for your market and your business. They have fully functional software for system modeling and event modeling. So really looking at the systematic flow of the factors that go into your industry. Is really the value that SimCAD Pro Health offers. They also have design analysis included in their software package. So that's that potential to design and analyze exactly the type of flow through your system uh, that you would have, and that would be that benefit for Tri-County. So that's why they're being put forward here as the primary option. As far as a cost, if Tri-County would want to purchase 3 licenses one for each of its hospitals, which would then involve 3 maintenance agreements. The total for that would be $15,540. Uh, Training is available, but that is additional. So unlike the analytics software, in this instance with the DSM, the training is an additional expense. There certainly are other vendors who can be considered. Simulistics software produces a product known as Simile, which is targeted more to research in the natural sciences and healthcare than the SimCAD Pro Health, which is really targeted to the industry. However, the Simile software appears to be a good bit less expensive at $300 for a one-time fee per user. One of the differences to explain relative to SimCAD Pro Health and Simile is looking at SimCAD Pro Health, they have models of hospitals for consideration, whereas the Simile software shows models of plants and the throughput for a plant system as the consideration. And certainly there would be other vendors that can be considered for a cost-benefit analysis. However, for this presentation, just to give examples of what software is out there, the SimCAD Pro Health would be the primary option and the market leader for consideration. For that DSM software, with SimCAD Pro Health being the market leader, here is an example of all of the capabilities that SimCAD Pro Health has to offer. In particular, looking at the 3D visualization, they offer that, as well as it's not on here, but there's a 2D visualization. So you can look at the different ways that the flow is going to move through your particular system. As well as then something for Tri-County to consider relative to this presentation is there are analytics capabilities built into the DSM software offered by SimCAD Pro. So when we're getting to that final point of cost-benefit analysis, considering any duplications of software offerings and minimizing those in choices may very well be to the best benefit of Tri-County as we make our final decision, whether that's for the Cerner in combination with the SimCAD Pro Health or whether that goes a different direction. However, noting what softwares may overlap between the big data analytics as well as the DSM software is important as we consider making these relatively costly decisions. So to wrap up, I hope it's become apparent that the implementation of big data analytics and dynamic simulation modeling software packages for Tri-County offer real benefits to help Tri-County be cutting edge and a market leader. What those software packages can offer are system optimization with better patient services that are faster, more accurate. They allow Tri-County to consider multiple theories prior to actually making decisions. They allow assumptions to be challenged as Tri-County moves through the decision-making process. There would be improved healthcare for the community, especially through that community care analytics software. Tri-County can improve its market position relative to those two university rivals by being more efficient and by enabling patients to receive services in a more timely fashion, as well as then helping Tri-County to become a more responsive organization, to truly be a leader in our community, having that immediate feedback where those RFIDs, those card swipes, those doctor and nurses notes, those drug utilizations are being incorporated into an analytic system that is regularly reviewed by personnel with the know-how to make the changes that are indicated by those analyses, will help Tri-County to be more flexible and more responsive and change more readily to best serve our community and our patients. Thank you for listening to this presentation. If there are any questions or comments for this presentation, my contact is included here. Please feel free to send me an email or reach out to me, and I will be happy to answer your questions. Thank you very much for your time and attention.